This is HIM 4431 Healthcare for Women presentation. This presentation is focused on the delayed healthcare among American Muslim women. In this research presentation, there was a total of 254 participants that range from different races and religious backgrounds. The groups that were a part of this presentation or this research study were Muslim American women, African American women, Arabian American women, and Asian American women. The age range of this presentation was between the ages of 40 to 75 years old. And the women in this study were English literate, and the cross-sectional survey was collected from the mosques and community events. This research showed that a lot of women delayed seeking health care due to religious beliefs and perceived discrimination. Religious beliefs and perceived discrimination were two big factors. However, one of the largest factors in the delay of the women seeking health care was due to the gender preference of a clinician. Some of the research questions that were used in the survey painted a picture. Basically, helped with the collection of the data and the analysis of the data. Basically, asked questions of when facing a problem, who do you seek for assistance? Do you seek a licensed physician, or do you seek a religious person? When facing health problems, do you perceive that how do you perceive the problem that you're experiencing? Did the women perceive the health problem as a punishment, or was it normal? How did the women react, or how did they feel in a mixed sex gathering or outside of the home? How did they dress? All this pertained to our was an explanation or once again a factor to their religious beliefs. What was their marital status? What was the highest level of education? How long had they resided in the United States? What was their annual income? Did they have health insurance? Did they even have a primary care physician? With those three right there, those three questions, could the women afford to go to the doctor? Did they have health care insurance? Could they afford to have health care insurance? And did they have a primary care physician, or that's where the alternative medicine aspect came into? Did they go to a religious person? Did they have a special person within their culture that they would go to when they weren't feeling well? Or did they visit a clinic? Age played a very important factor in this research. Their racial and ethnic background. Different cultures had different beliefs. And we found out throughout the research. And one of the most important questions that we have found that a very large percentage of the women agreed and produced the same answer was a lot of the women delayed seeking health care when there was no female clinician or doctor available for them. So playing off of a lot of the research questions, the survey really focused on the religious aspect of the culture of the women. Did they feel discrimination? How did they deal with the modesty feelings that is related with some of their religious beliefs, alternative medicine, as mentioned earlier, and worship practices? Now, we found that a lot of the Islamic beliefs suggest that it's okay and you may prevent seeking treatment if the illness is considered peace for one's sin or believe that the disease is fated for her. In the American culture, we would possibly relate that to what we call karma. But in some aspects, the women were also limited to preventive screening. It was a 50-50. Some women went to have their preventative screenings, some did not, for the same reasons of a lack of same gender clinicians. But in my experience, the husbands could and sometimes do call to make the appointment for the ladies. They will give also the medical history pertaining to a routine screening mammogram to detect breast cancer, and also a routine or and annual gynecological visit, which focuses on a pap smear for cervical cancer and HPV screening. Throughout the study, we found that the women's attitude and the practices that they have elected as far as delaying health care revealed that there was an underlying lack of trust and an unfamiliarity with the health care system. Throughout the research, we have found that the two largest factors pertaining to the delay in health care was modesty and religion discrimination. With the modesty aspect, a lot of Muslim women revealed that they had some fear and embarrassment when it came to visiting or having a different sex clinician available to them and preferred the same sex clinician. Arabian Muslim women reported feeling uncomfortable for breast exams, which I totally believe that that can be all women of the world feel some sort of uncomfortableness when it comes to breast exams. But once again, dealing with the modesty aspect of their experience in religious beliefs, a lack of same gender doctors and clinicians played a extremely large factor. Not only was it just Muslim women, part of the research also informed us that it was Korean American, Chinese, Philippine, Asian, Indian women. They all felt the same way when it came to the choice of a clinician being the same sex. As far as the religious discrimination, we said perception of discrimination because it could be some blurred lines when it came to that, but a lot of the women felt that it was not as much courtesy to them. It could have been less, they felt like they weren't respected, less respected, less courtesy. And overall, their experience just basically was perceived as poor medical service overall. Now, in the chart that you're currently looking at, the pie chart here, it shows that with the Asian and Arabian American women, they had about the same percentage showing as 33% of them um, chose to have delayed care due to, it could be modesty, it could be religious, but definitely, like I said, across the board, all women shared that they preferred same sex clinicians. African American women show the smallest percentage, is 26% over the other culture of women. It could be more Americanized. It's just a proven fact that they've probably been in this country a lot longer. Some, not as much as others. And as we can see here, the larger percentage is the Muslim. Um, Muslim women had the larger percentage at 53 due to a large reasoning for their religious beliefs of same-sex clinicians being available for an appointment. A lot of the information gathered from the total 254 women, the outcome was that out of 129 out of the 254 basically admitted that they delayed seeking care due to lack of a female clinician. And almost double that amount, at 224 participants, agreed that they chose to maintain their religious beliefs. That was more important to them if they could not have the female clinicians. So, in saying that, there was still a small percentage of participants that has resided in the United States for more than 20 years. They had lesser percentages or a smaller percentage when it came to seeing a healthcare provider that may not have been the same sex. Now, of course, we just shared that women that lived in the U.S. were more likely to see a clinician even if it was not of the same sex versus other participants who by chance have not lived in America as long or chose to follow their Islamic beliefs, but contrary to the entire to the theory or the hypothesis of the study, there was not a significant amount of information associated with the delayed health care versus religious discrimination to show that that was just that one and only factor. But in conclusion, there is a large percentage of women that prefer same-gender clinicians, and the hospitals are making efforts to ensure providers for both sexes are available at all times. Policies of female staff is being enforced and being provided on a daily basis. So overall, future studies will possibly change the percentage of the numbers that was presented to you today. It probably, hopefully it will go down. It will be better education, more exposure, and the healthcare system is working to provide excellent healthcare service to all patients. And with continuing studies and presentations, they're learning more and they're providing better service with the information that's being gathered. And also with the healthcare system improving, hopefully so will the cultural groups that were participants, and continue learning and changing the learned behavior of their culture and ethnic groups, and just learn that we're all here working together for betterment and to a betterment of man in healthcare as a whole. This has concluded my presentation, and you have a good evening.